Good morning, everyone. Welcome to today's live update. I'm Chancellor Donde Plowman. This is a busy week here on campus. Yesterday, we reopened Massey Hall as a temporary isolation housing for residential students who test positive for COVID-19. We also received initial results from our first week of pooled saliva sample testing. But before we get into those topics in today's data, I want to talk for a moment about flu season. As we head into flu season, one of the best ways to protect ourselves, our community, and our healthcare system is to get a flu vaccine, a flu shot. The Board of Trustees authorized a flu shot requirement this year for all students, faculty, and staff. Employees must verify they've received the vaccine or request an exemption for a medical or religious objection through IRIS. Students can do the same through the Student Health Center portal, the patient portal at the Student Health Center. To help meet the flu shot requirement, we are holding our first clinic this Thursday on campus. You must register through our reservation system if that's where you'd like to get your flu shot. You can find more information on the campus calendar and in yesterday's Tennessee Today and Fall update. So now let's go over today's data. We currently have 73 COVID-19 cases. 69 are students and 4 are employees. So that line has continued to go down, which is a good thing. We also have 298 people in quarantine or self-isolation. That's on the next chart. Again, the numbers moving down like we like for them to have. I'm sorry, I missed that previous chart. I misspoke, so we're going to get that back up. We've added this chart now, and we're tracking or showing, we were tracking it, but showing the number of new cases each day. So again, you see the downward slope in the line, which has contributed also to the downward slope in the line of people quarantining or self-isolating. Right now, there are 298 people in quarantine or self-isolation. That's down considerably. Of those, 263 are students, with slightly more of them being non-residential than residential. Let's talk about testing. So, as you all know, we started our wastewater, we've added wastewater testing and pooled saliva testing to our toolbox in the last couple of weeks. So I have some questions here for Dr. Crawford, who's our Vice Chancellor for Research. So just to start off, Dr. Crawford, how's it going with the testing? How about an update there?
Sure, I'd love to provide an update, Chancellor Plowman. We collected and began testing 574 saliva samples last week from students who live on campus. The samples were processed in pools, or that's groups of 5, to detect presence of the SARS-CoV-2 virus. That's the virus that causes the COVID-19 disease. About 5% of the samples remain to be processed today, but as of last night, 21 individual samples from the group of 574 have been referred to the Student Health Center for follow-up.
Well, that seems like a good number. Not to jump too quickly on good news, but that percentage rate is lower than we saw coming out of Massey.
That's right.
And I realize we didn't get every single person tested, but that seems like good news. So what do these results tell us, Dr. Crawford, about the presence of the virus compared to the known active case count that we've been monitoring through our self-isolation?
So these results tell us that the virus is pernicious and is likely being spread by individuals who don't know that they've been infected because they're experiencing no symptoms, or they have very limited symptoms that they attribute to other causes like allergies. Our concern is, of course, that because it is so infectious, asymptomatic student carriers will spread the virus to others in the university community, in their families, or in the Knox community more broadly, others who may experience the COVID-19 disease with much more severe symptoms and consequences.
Okay, so that would be like people who may have underlying conditions, a student, a friend who has diabetes, and you may not know that, a parent who may have struggled with other kinds of diseases. So those are the things we're really especially wanting to be careful about, as well as not spreading it into the community to cause an overrun in the hospitals. So I want to thank all of our residents who participated last week. Our pooled saliva test will continue every week through the rest of the semester. This is going to become a normal part of being at the university. And I want to thank everyone for their involvement. The data from our comprehensive testing efforts will be critical, informing us whether we can lift campus restrictions, those that are remaining going forward, and ensuring that we continue to have an on-campus experience for students that's safe and meaningful. So let's talk for a minute about Massey Hall. We've mentioned that we were emptying it out, and we were getting it, testing students, getting it prepared. Yesterday, we reopened Massey and began housing resident students tested for the virus. These students are identified through self-isolation forms and contact tracing. Our staff has been working hard to not only prepare the residence hall itself, but to also expand the resources and support for students in isolation. We know this can be a difficult time for students, cut off from your friends, so we've tried to make it as comfortable as possible. We've streamlined our dining services for these students, opened up the courtyard for studying and socializing, and organized social activities. These students, if well enough, are still attending their classes virtually. So, Provost Zomchek, I have a couple questions for you. How can faculty support students during quarantine and self-isolation? What are we hoping and expecting from faculty along those lines?
Thank you, Chancellor. As you know well, throughout this semester, we've appealed to the faculty to be flexible, compassionate, and creative as they manage all of the challenges that the pandemic is bringing forward. I think this is especially important for the group of students that will be in isolation in Massey. In addition to the usual challenges that all of our students sort of find during the semester, faculty need to keep in mind that these students bear an added burden. They're in new and temporary quarters. Some of them will have symptoms and will be ill. So I'm asking faculty to be proactive, reach out to them, see how they are doing, see what they are able to do if in fact they do have symptoms and can't keep up with the work, extend due dates, think about alternative ways of assessing their progress. Above all, be committed to their success. I also, though, would like to reach out and to let our students in isolation know in Massey that we are absolutely committed to their success during the time of their isolation and after the isolation is over. We are working to have our academic coaches inform their instructors that they are in isolation so that the instructors, the faculty, know about it. For added insurance, though, if you can, students in isolation, please communicate with your instructors directly to let them know that you're in isolation. That's just a kind of added insurance that the instructors know so that they will be able to reach out to you and see what it is you need in order to continue to be successful.
I know you and I, John, are each teaching a class this semester, and I know in my class, we started off with everyone there the first couple weeks, and then at one point, half the students were in isolation, but they were still with us on Zoom. At the beginning of every one of my classes, there's a student who's making a presentation, and we've been able to do that. Sometimes they were at the hotel or in the dorm room, in the classroom. We're kind of back up to good numbers again. Tonight, we have a special speaker, so it is all by Zoom. And I think that characterizes a lot of what's going on in classes. It's a little bit of a class in motion, but we're all together, and that's been really great. And I've really enjoyed doing it, but it's a different kind of teaching than I've ever done. I'm guessing you've had the same kind of experience, John.
Absolutely, and almost exactly the same experience that you're describing. I mean, what I've been doing and what I hear our faculty have been doing is really improvising, trying to make sure that we keep in focus the fact that, yeah, it's challenging to us. managing in class and on Zoom, but it's especially challenging to our students and, our first year students who had to make that transition from home to campus. And we need to keep in mind that they may need a little bit of extra encouragement. So one of the things that I always do, I always begin class and end class with a little bit of a pep talk to let them know that we're here for them, that we're invested in their success, and that we're going to get through this together.
I can imagine it's a very effective pep talk. You're very positive. So just one last question, Provost Somchik. Are there any other kinds of academic supports available to students others than what you've mentioned here this morning?
So, Chancellor, as you just said, Zoom will allow us to do many things. So all of the wonderful services that we have for all of our students, tutoring, supplemental instruction, they'll be available to our students in Massey who are isolating. But we're also going to have an academic coach reach out to each of the students to make sure that we know if there are any special needs, special academic needs that they might have during this time. And based on what they learn, the coaches will connect them to the services that will help them continue to succeed in their classes, tutoring, advising, whatever it is. But again, to the students, you don't have to wait for coach to contact you. If you feel that there's something that you need to be successful, then go to the website of Student Success, studentsuccess.utk.edu, and let them know that you'd like to have someone get in touch with you as soon as possible. But someone will contact them, and we're going to do our very best to make sure that you're connected to all the academic services that we have out there to ensure your success.
Okay, thank you. So let's just think about what we covered today. Flu shots are important. My doctor told me, she even said, you should probably get 2, Donnie, not just 1, but we'll start with 1. Flu shots are important. Our numbers have gone down. Our testing's going up. We've got a very amazing group of faculty who are helping lead that testing and research efforts. And the staff are terrific. And I want to thank the students. We will be requiring pooled saliva samples, dorm by dorm, house by house, as the semester continues, so we can identify and isolate folks who need to be away from others for a while. And then finally, Massey Hall's up and available, new services that we haven't had in the past, and continued support from academic coaches in student success area for helping students get to the finish line this semester and feel good about what they've done. So I want to thank you, Provost Somchik, Vice Chancellor Dr. Crawford, for joining us today. We will be back on Friday with our next live update. So thank you and go Vols.